We're gonna do all the ones lying down first. All right, and it's your right knee and right hip, correct? All right. Would I be able to do her hip?
No.
No, I'm gonna put her in shorts, good. Then we can be like, oh, that's so easy, we'll just unzip her for surgery.
No.
All right, now, do you see the distance here to here? She's rather small, and I need to make sure that you guys see this. I wrote this down. There is a measurement here.
Sure.
Okay, we measure here. She is 14 centimeters. Okay, when the femur is lying down like this and they're little, they don't have a lot of junk in the trunk like some of us do, then the knee joint is up a little higher, okay? So you have to angle down just a little bit, okay? There, I wrote down my measurements here. Okay, so she's little, so she is equal to or less than 18 centimeters between the table and her ACES. So we actually need to angle 5 degrees caudal on her, okay? Anybody who's 19 to 24, perpendicular. Anybody who is 25 or more, lots of junk in the trunk, because their femurs then are going to be sitting, because they are all boosted up, like this. And we're trying to get into that joint AP, right?
Mm-hmm.
So if they're level, straight, if they're low, then we angle down, okay?
What was it, 18 and down, 19 and up?
It's page 346 in your book, and it's right there if you guys wanna look at that to make sure you have your measurements. So for her, she's little, I'm gonna angle it down 5 degrees. Does that make sense?
Yes.
Now, where is my centering point for her? Where do I center on the knee?
Half an inch below the
one.
apex, half an inch below the apex.
Inferior, half inch, inferior below the apex of the patella. Do not center at the center of the patella or above the patella. I had a student yesterday, and he's centering up here still. I'm like, you are too high. You need to be down low, because you're not hitting the straightest part of the central ray into the joint space. Therefore, that divergent ray is going to project that joint space a little bit closed, okay? So we need to center a half inch below the apex of the patella. If she's hurting, I can measure on the other side, right? Okay, so we can always go about a half inch below the apex of the patella, okay? We're gonna collimate to a 8 by 10, so we can move the other leg out of the way. Let's bend that knee a little bit, there you go. So we don't get her in there, and then we're gonna make sure her foot is straight, okay? And we're gonna line up the foot. Because I moved my, and I'm at an angle, oh man. Therefore, we have to angle it. And,
What?
No.
okay,
It's haunted.
it is haunted.
It moved back.
That was weird.
I know.
Yeah, I don't like
I
that.
said not possible.
Oh, probably. 'cause
I was
it's
today
down.
years
There we go.
today
That's
years
right.
old when it discovered it does that.
Yeah, it's this button here.
Oh.
Okay,
That's why
there's
I
my
spread it
AP,
out.
right marker right there, okay? Now I want an internal oblique. Why do I wanna do internal oblique and not external? What am I looking for? Do I remember that in Ollie's lecture?
Joint
space.
Yeah,
What
that's how I was
joint
gonna go. The joint space.
What joint space?
Lateral meniscus? Or
Knee
never?
joint.
The intercondyle.
Patella.
Nope.
Eminence.
Eminent fossa.
Knee joint.
Same range.
Fossa has its own.
Please reach over there and turn your body. We are looking for the
Eminent.
tibial femoral, the tibiofibular joint space. Because the fibular head locks in just posterior to the tibia. So we want to come in and see that joint space open, okay? This is the only view that will see that joint space open. Her fibular head is right there. So we still wanna come in a half inch below the apex of patella. Now I just slide that over there. Use our other leg out.
Do you still need that angle on there?
I do not. Good catch, right? Because now her hip is higher. So, good catch. Now I need to go perpendicular. Okay, very good. See? Love this. I moved my, that, I moved my that. Okay,
I'm just kidding.
okay. Right marker right here. Okay? Now, why did I put that there under her hip?
So she doesn't move.
So she doesn't move, she stays, right? If I don't have that and I just have her move her leg in, let's try it. Now, all I want you to do is just rotate your leg in. Do you see how it bowed? Okay, it's not straight, and she's a little old lady. Is she gonna be able to hold that for very long, or is her foot gonna start to relax because it's
I will
uncomfortable?
relax.
Exactly. Use your positioning sponges, because then you're not gonna miss it, okay? All right, so there's your AP and your internal oblique. Let's do our Beclaire method, super easy. All we're gonna do, and if she hurts, we can have this, and just put this right under her knee like that. Relax, okay? Foot is straight. Get you nice and straight, lady. See how her tibia is at this angle? I want to be perpendicular to her tibia. If her knee's up a little higher, I'm gonna angle a little bit more, okay? So, let's put that right there for you. Okay, you good? Okay. Beclaire. So, I'm just going to angle
last one?
to her leg. That looks pretty good, right?
Knee does.
Mm.
How do I know?
This is perpendicular.
Just looking.
Step back and look. Is it perpendicular? That's what I'm looking for, okay? Again, right below the apex of the patella. Slide her over. Check my centering. That looks pretty darn good. And a right marker right there. Okay?
How much did you angle?
I angled it to her tibia. Okay? If her leg is a little higher, I will angle a little bit more. If it's a little lower, I'll angle it a little less. But we want at least a little bit of an angle in there, because what we're doing is
weird,
trying
maybe.
to open up that joint space to see the tunnel of that. And the tunnel, literally, I'm gonna draw a nice little picture here, because you know how I love to draw. Here's your tibial plateau, and then you have your tibial spine, like that, right? And then your femur, or your fibula is down here. And the femur comes down like this, okay? And then your patella. So what we're trying to do is, by doing that, we are able to see that tibial plateau really well, okay? Super important, because there are 6 ligaments that hold that knee together. And if they have an avulsion fracture, what is an avulsion fracture? It is the tearing away of a piece of bone, which can happen here. So now this little piece of bone, instead of being connected there, is now torn away, and they know they got a ligament fracture, a ligament torn, okay? They also do this for tibial plateau fracture.